New York's Andrew Cuomo has become an outspoken voice in this crisis with his blunt and sobering assessments of what his state faces. I caught up with the governor today to talk about the challenge and how he has responded to it.
Oh, it's all surreal. It has to be, Lester. I mean, this is like living a science fiction movie, right? Our strategy here is prepare for the worst and hope for the best.
This is a military hospital, essentially, a field hospital. You spoke to National Guard troops today in a stirring speech that, if I wasn't listening carefully, I thought you were sending soldiers off to war.
We go out there today and we kick coronavirus ass.
Do you feel at this moment like you're a wartime commander?
Well, I wanted them to understand this is a different kind of enemy. It's an insidious, invisible enemy. And people are going to die. People are going to die. No matter what we do, as good as we are, as hard as we work, people are going to die. And that is the sad reality of this situation. And it's even compounded by the fact that this is an enemy that attacks the weakest among us. And how can we not have protected them, right? This is my mother, this is your mother, this is our parents, our grandparents. How did we not protect them? So it is a totally different engagement than anything we have dealt with before.
Let's talk about ventilators. President Trump has suggested that maybe you don't need those tens of thousands of ventilators you have spoken about. Were you surprised to hear that, and what's your reaction?
Oh, look, I hope he's right. You know, I hope no one gets sick. I hope no one needs a ventilator. But I don't operate on what I hope or what I would like to see or what my expectation is. I operate on the data and on the numbers and on the science. And every projection I have from multiple sources, and these are worldwide health experts, say that we have to be prepared for an apex of 140,000 hospital beds and 40,000 ICU beds with ventilators. I hope they're wrong. I hope I don't need 40,000. I hope I don't need 30,000. I hope I don't need 5,000. I hope this whole facility, Lester, stays empty. And we built it for nothing.
But you don't believe that's going to be the case?
The numbers don't say that's going to be the case.
Then there's the issue of personal protection equipment for healthcare workers. Governor Cuomo saying this on Wednesday.
Today, no hospital, no nurse, no doctor can say legitimately, I don't have protective equipment.
But the New York State Nurses Association firing back they don't have the proper protections. Wearing a soiled mask for days at a time is not adequate. Has there been a failure of distribution? Have you pinpointed what's going wrong?
What people are complaining about is the CDC has changed their guidelines to crisis guidelines about how many gowns people should have, how often they should change their gowns, how often they should change their masks, etc. They think that the change in the CDC guidelines doesn't protect them. But we have provided that equipment short-term to all the hospital administrators.
When you hear conversations, this drumbeat of getting the country back to work, the economy back to work, how do you process that?
Look at the facts. Look at the facts. Yes, everybody wants the economy back. I want the economy back. My state is hemorrhaging money. It's hemorrhaging jobs. Do you think I want people sitting at home and not getting paid and worrying about how to buy food? Of course I want the economy back. But you know what I want more, Lester? I want them alive. That's what I want. And I want to minimize the number of deaths. And to me, that still comes first. I think there is a way to do both, to start the economy and protect public health, but don't ask the American people to choose one over the other.
Governor Cuomo says while hospitalizations are increasing in New York, they are now climbing at a slower rate. That's a glimmer of hope, a glimmer. And he frequently points out that 80% of COVID cases are resolved at home. Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.